You're listening to
Fresh Out the Game.
Man, I be so fresh. Fresh Podcast Network.
בלי קשקושים.
Straight from Tel Aviv, Israel.
רק מה שמעניין.
Let's go.
Hi, my name is Hilal Leizarovich.
And I'm Ron Avon. We are two entrepreneurs from Israel, and we are on a journey to find out what makes entrepreneurs, investors, and CEOs
Succeed or fail.
and we hope to inspire your journey. Hello everyone, and welcome to another episode of TLV DNA. And today with me here is Kfir Oved, the founder of MeMed, co-founder of MeMed.
Yeah.
And let's dive in. But first, give us in a nutshell what MeMed's doing and, a bit of background about you personally.
Okay, sure. With pleasure. First of all, thanks for having me. So MeMed is basically a personalized diagnostics company trying to utilize the immune response and the host response of our body in order to translate that into diagnostics, meaning to answer questions for physicians with regards to what exactly my patient is experiencing, how should I treat it, and whether this treatment is working. So that's basically what MeMed is trying to do. We'll get into the details, I assume, a bit later. About myself, I have a dual background in biology and medicine. I took med school in the Technion Institute of Technology in Haifa here in Israel, and also did a PhD in immunology. Basically worked in cancer immunotherapy, systems immunology, and other boring, geeky stuff around immunology. So I'm an immunologist by heart and soul.
Great. Okay, let's dive in. You started the venture. Where did the idea came from? How did you validate it? When did you actually got to an actualization when you said, wow, I got a good idea. I'm going to create a startup?
Yeah. So it's first of all, we need to be very accurate. It's not me, it's we. So I have a co-founder called Eran Eden, and we basically co-founded MeMed together. And MeMed is actually the result of a few years of mutual work in the academy. So we started actually as two academic partners trying to work on a system that I was interested in related to cancer immunotherapy. And without getting into the fine details, I had to join someone with a more computational background into my academic work. And since I knew Eran and I knew his mentor, I approached him and we actually started this work in melanoma, metastatic melanoma, where the question was, how can we improve cell therapy to melanoma patients? And we came up with a beautiful work that was published in one of Nature's subpapers on how to potentially improve the treatment of metastatic melanoma patients. And that actually taught us that by combining the worlds of biology and clinic and more computational and statistical approaches, we can actually create a synergies and we can, make from 1 + 1 3. And that was actually the inspiration to founding something together. So MeMed was not called MeMed, was not really existent, and we didn't even know what we're about to do, but we first started to just make a decision. We're going to make something together. We're going to combine these two worlds together and try to find really massive problems to try to tackle, that we can bring these two worlds together and bring something fresh, something new into the world. So that was basically the very, very basic start. And it took us quite a lot of time to really crystallize to ourselves what needs to be done. And that was an amazing year and a half, give and take, 2008 till mid-2009, give and take, where we had a hammer and every problem looked like a nail. But, there were screws there. Some of them are rusty. So we actually went through a few different ideas. Some of them we even thought that are really amazing. And then after walking out and start talking to people, they just gave us, sanity check, actually asking questions that we didn't have good answers for. And maybe one of the most, early and most important lessons that we learned is that don't be secretive. Go out,
share,
speak with smart people that you trust, that you think highly of, about your ideas, because if you cannot convince them, or if they have some questions that you cannot answer, there are two options. The first one is that you need to go and work harder to find some really good answers to these questions, or alternatively, it's not a really good idea. So go and waste your time somewhere else.
Yeah. So I love that you referred to crystallization, but you say it's a year and a half. Give us some more high resolution of that process. How does it work?
So it works, but by raising hypotheses and exploring them. I came up with my clinical experience from med school. I was a med student these days, so I bumped into many clinical situations these days, and these were the inspiration for these potential problems that we might want to solve. The first one, for example, that many Israelis know is the stroke of Ariel Sharon. So Ariel Sharon experienced a stroke which was hemorrhagic and not thromboembolic.
Just to say, the audience that don't know Ariel Sharon,
who is the ex-prime minister of the state of Israel,
yep,
who experienced a stroke. And one of the challenges in treating stroke is that about 85% of the patients with stroke in the emergency department have a thromboembolic stroke, which means that one of their blood vessels in the brain was just occluded. But about 15% actually have hemorrhagic one. That means that one of the vessels is leaking. And the treatment is not only different, it's actually contradicting. So if you treat one with the other therapy, you're actually killing the patient. And we don't have great tools to try to differentiate between the two. So that, for example, was one idea on, hey, this is a really big problem impacting quite a lot of people, and is a big clinical challenge. So that was, for example, one opportunity we explored. The second one was, again, and today there are quite a lot of Israeli companies trying to do that, is actually continuous monitoring in the intensive care unit of intensive care patients, and try to build the algorithms that will predict whether a patient is about to deteriorate, and therefore provide early therapy, early remedies in order to improve outcomes. So these were all great clinical ideas, okay? But with all due respect to the clinical problem, you also need to make sure that you have a really groundbreaking technology that can actually solve it.
And deliver.
And once you are sure that you have that, you really need to make sure that you have a business model around it, okay? And this is usually where we bumped into a wall on the business model side. So that was basically, just a taste of the different ideas we had. And one day, came this day, I had an infectious disease lecture session in med school. And we actually went through the rise of resistant strains of bacteria. And basically we learned that more and more bacteria are becoming more and more resistant to the antibiotics we have. And this is basically been driven by one single behavior of human being, which is overuse of antibiotics. We use antibiotics far too much, not only on ourselves, but also in livestock and other arenas. And
what do you mean we use? Nobody takes antibiotics just by himself. When we say we use,
first of all, some do, but yeah, physicians tend to overprescribe antibiotics.
Right,
that would be a more accurate one. But I think it's far more complicated than actually physicians making this trivial mistake, because physicians are not stupid and not reckless. So
yeah, but it's a mindset.
There are a lot of reasons for why physicians are overprescribing antibiotics. But basically, the outcome of that is more and more resistant strains of bacteria. And this is for itself a problem which is not an infectious disease problem. This is a threat on modern medicine as we know it, because no antibiotics means no oncology, no orthopedics, no dentistry, no neonatology, no nothing. This is the mainstay of medicine. If we lose antibiotics, we lose modern medicine as we know it. So this is not a small problem. And if we do this, methodological stop about, young entrepreneurs, I would pursue to them to try to find massive problems. Not just big, massive, because it more or less takes the same amount of effort and has more or less the same probability of success to try to tackle a small problem and to try to tackle a big one. And this was like a giant one. We immediately realized that. And, I'm an immunologist. So again, you have a hammer, so everything looks like a nail. So that looks like a classical problem that the immune system is solving, right? Because our immune system can actually respond differently to bacteria and to a virus. So what if we can just ask the immune system, whether it's bacteria or virus, and by doing so and providing the results within a few minutes in practically everywhere in the medical system, we can actually reduce the amount of overuse of antibiotics just because we will be able to flag those viral infections, which are responsible for about 80 to 90% of the overuse of antibiotics. So that was the basic hypothesis. I raised my hand, asked my lecturer, and he said, Kfir, come on, we have serious things to discuss here. Let's talk about that in the break. So I bugged him in the break and I asked, why don't we use the immune response or an immune signature, if I may call it this way, to actually differentiate between these two situations very quickly? Because if we can do that, we can reduce significantly antibiotics overuse. And he said, listen, this is a really interesting idea, but I don't know exactly why and how to do that. But if you have any idea, I'm happy to follow up on that. And, immediately when I came back home, I picked the phone, called Eran, and said, Eran, listen, I think we have an interesting problem to try to think of. And because our mutual academic work was around trying to identify those patterns of the immune system, just in cancer, but still very similar conceptually, not technologically or scientifically, but from a conceptual perspective, it was very, very similar. I think he fell in love with the idea very quickly, and then we were trying to kill this idea. So the next step was, after we understood the potential over there, was to try to kill it. And no matter what we did, we couldn't kill the idea. And that's basically how MeMed started.
So again, we have a great idea. We don't know how to tackle it yet. Let's go into that process, how you define it again and again. And like you said before, how you crystallize till you get to this, idea that can really happen and might be feasible.
So I think if you're trying to think as an entrepreneur, there is a very structured pitch for investors. And if I would try to reduce that to the bare minimum, this is also the thought process that you should do. So you should first start with a problem statement. What's the problem?
Define
Make
the problem.
sure that you're defining it well, because as Elon Musk said, you need to think from first principles. To think about, hey, they do it this way, but it can be done better. This is not necessarily a good problem definition. You need to really define the essence of a problem. What is the problem? Okay? And the way we defined it is people overuse antibiotics, create antimicrobial resistance, because differentiating between bacteria and a virus is really hard from a clinical perspective for all sorts of reasons. So that's a problem. What are the solutions? What are people doing right now? Because guess what? If there aren't any solutions, there's probably no problem, because you're not the first smart guy on earth to define this problem. So even if there are some suboptimal solutions, there must be solutions out there. And then what do you think should be done? And how does that overcome the obstacles or the gaps that are still remaining? And how is that going to change the world dramatically compared to what's before? When I say dramatically, you cannot incrementally improve reality and expect that to be a wow venture or startup. Again, mantras, but mantras work. It needs to be 10x better. It needs to be significantly better, okay? And that's where you should stop as the bare minimum. How do you make money out of that? So let's assume you've done what you think that should be done. Let's say that biology danced with you, or medicine danced with you, or the software danced with you, and you were able to create what you wanted. How are you going to make money out of that? Is that a completely new business model? Is that an established one? Is that something that requires, collaboration from others or other stuff? And again, here, my advice would be always to try to find an independent business model, which means that it's not dependent on partnering. It's not dependent on third parties. It depends on you, even if it's longer, even if it's more expensive. And B, ideally try to utilize other models that already worked in the past and not to reinvent business models, because there is enough innovation in the way anyhow. You don't need to reinvent the business too. So that's a little bit about the process. And that's exactly what we've done with the bacterial versus viral diagnostics. So just to name the different stages, I define the problem. Solutions are multiple. They take a lot of time. They're outside of the clinical workflow. They cost a lot. They have blind spots of sensitivity and specificity. Specificity means they miss both some of the viral patients and many of the bacterial patients. So they cause two types of errors. And eventually, we believe that the immune system is the best way to detect this specific question, just because it was evolved for who knows how much time to do exactly that. What is the business model? Oh, it's easy. It's diagnostics. So there are tons of diagnostics company, and we know how to sell and how to make money out of high medical value diagnostics.
All right. I love the way you described it. I just read the biography of Elon Musk. So he says there, you could address a wide innovation spectrum. That's where you try to solve something and, bring better results. But you said you want to go into a vertical innovation where you take it one step forward and you really innovate something new. But when you do that, you might create a platform for a new business model, right?
Indeed.
So let's try to focus there and tell us about.
Oh, it's really early to talk about the asset-centric versus platform play, because that's really amazing that you asked this, because MeMed started as an asset-centric company. We started as a one-trick pony, but from day zero, and it's not a retrospect, editing of history. I actually remember the discussions with my partner early in the days about what does that mean about future diagnostics? What does that mean, about our ability to provide many other potential solutions in completely different clinical questions? And I think from day zero, even though the company was built around a very specific product, it was actually created as a platform. And again, I was asked not to be in 200,000 feet, right? So,
yeah.
So I'll try to go from philosophy to practice, but it always starts with philosophy, and you'll need to excuse me for that.
Go ahead.
I think in order to build a really big company in our field, ideally you should, and that is actually either an asset-centric or a platform play. I'm always on the platform play side. And it has many reasons, both in terms of potential value that usually platforms can provide, B, in terms of the ability to solve more than one problem, C, in terms of the risk mitigation that you're almost naturally creating by doing more than one thing, even though focusing is another thing that we'll need to discuss in details.
True.
But in order to build a platform, you need two things: infrastructure and language. Our infrastructure was a device. So the ability to do the measurements, the ability to measure proteins very quickly everywhere in the world, that was actually the second part of our journey. The first part of our journey was to create the language. And the language that we decided to create was the language of the immune system. So we started to speak, if I may call it this way, we created this language, which is the immune system language or the host response language. And that is the way we actually were trying to communicate, the information that the body is actually creating, providing us, and translate that into...
That's science fiction. That's science fiction. I love it. Go ahead. Yeah, but that's
So let's
beautiful.
take it one level deeper to try to crystallize it again to practical things. So eventually, it's the ability to measure molecules, proteins and other types of molecules of the immune system, to measure them accurately enough, to combine them, because there is no single molecule in biology that can be accurate enough, because biology is noisy, is extremely noisy, okay? So let's take a few of these, use information technology, use data and data science, combine them together, and actually create intuitive, human approachable results. It's
language.
Bacterial, it's viral. The physician doesn't care what is the name of the protein, what is the molecular size of it, what is the PI of it, how hard it is for me to measure it accurately. All he cares about is this patient in front of him and what should I do with my patient. That's exactly what physicians are focused on.
Let's just pause there for a second, and I wanna teach our audience a Hebrew word, a slang Hebrew word. We say tachlis, okay? So that's
the point.
To the point. That's what you're saying, right? You want it tachlis, to the point, to address the doctors, the physicians.
For me, it was very intuitive, personally, because once you put a white coat on yourself, even if you're just med student, because I didn't tell you that, but I never practiced medicine. So I graduated the Ministry of Health exams, and that was the end of my medical career. But med school was enough experience for me, after putting a white coat, to think like a physician. And eventually physicians, when they send, for example, lab results, they don't even know how these tests are being done. They don't know the machines. They don't know the technologies. You know what? They couldn't care less about it. The vast majority of physicians never visited the lab.
They just want the results.
But they want the results, and you know what? 70% of their decision-making is based on this paper that they get back from the lab. So I always approached it, and I think myself and Eran, always approached it in a way that is going to be clinically relevant, actionable, easy for the physician to interpret and to act upon, and something that can actually impact the clinical practice. Otherwise, it's just information. And there is this hypothetical question, there was this test for Alzheimer's, okay? But there's no cure for Alzheimer's. So what's the utility in diagnostics for Alzheimer's? So some will claim that there is. I'm not arguing against or for. I'm just giving that as food for thought for people. If it's a question with zero actionability, it's just information for the sake of information, it's going to be a hard sell, for physicians and for the insurer, because you also need to show that there is some economic value behind what you're doing.
Economic value, business model.
Sorry.
Let's go dive in there. And how did you establish the business model? How did you explore it even? A lot of people out there having a lot of trouble deciding which business model to take into their vehicle, their startup, and execute it. Tell us a bit how you brainstormed about it, how you tested it.
So value comes in two flavors when it's, and I'm very specifically talking about medical. And I would like to put this disclaimer here because there are completely different industries where many of the things I'm about to say are completely wrong. So everything needs to be taken in the right context. Mm-hmm. When it comes to medical, you need to ask yourself two basic questions. What is the clinical utility? In other words, how do you improve care? Do you make a better diagnosis, a more prompt diagnosis? Do you allow the physician to make the use with the right drug compared to the wrong one? Can you measure the response quicker than anything else? Do you reduce mortality and morbidity, basically, okay? So that's one part of the equation. The second part of the equation, which is there, and don't be shy, you must deal with it. What is the economic impact of what you're trying to do here? Is it going to be an overburden on the system, or is that eventually, and you can show that, going to reduce the economic burden on the system? Because if you have both clinical utility and you have really good health economic arguments, you're a king, okay? You're in a great shape to actually move forward. If you bring only clinical utility, there are some cases that even in the price of much more money for the system, your innovation is still going to be valid. For example, in young kids, for example, in pregnant women, for example, in certain situations where the society is willing to pay endless amount of money.
When the value is really greater than the economic burden.
I would even say that, because I don't think that one person's life is more important than other. I would even say that it's a cultural thing. There are some subpopulations where, almost everything is valid. I mean, if you can help them, great, we'll pay you whatever you want. But let's put it this way, in 95% or 98% of medical innovation, this is not the case. So you need to come up with a very mature and conservative approach showing that you're not only providing better health, you're also providing better economics.
And how did you manage to do it?
How do you do that?
Yeah.
You first start with the first part. the way we started with the first part was actually one of the biggest leapfrogs that we've done as a company. There is this confusion. You're a UX, UI guy, right?
Yeah.
So there is a confusion between a concept, a technology, and a product. Okay?
True.
So in the first 3 years, we've created the technology. We came with a concept, let's utilize the immune response. We built a technology to do that, but that's just technology. A PhD in the lab can do that. But, what is that? How does that help the primary care physician? The next 2 years, we're actually trying to take the company from technology to a product. And guess what? In medical, that is much more challenging than you would expect because there is this tiny thing called regulation that you need to pass. So it's not only enough to make sure that it's working, that it's manufacturable. You actually need to show that it's working from a regulatory perspective. So you need to prove the regulator that it works. So we took the company and I'm probably one of the worst regulatory guys on earth, but one of the nice things about being a co-founder is that you need to learn everything. And I took the company through ISO 13485, which is the medical device ISO 13485. And I suck at it. Don't take me as an advisor. It's 1345. The QARA that arrived after me just hold their head, But it was good enough, just good enough for the company to submit our product, make the regulatory claims for use in Europe and Israel, and launch and learn. And maybe one of the mantras that people have in software is like the launch and learn, right? This the lean startup mantra, launch and learn.
Yeah.
And all the medical guys are saying, hey, yeah, that's nice for software, right? But that's not true for us.
For medical.
So that's not always accurate. I mean, there are certain areas where you can launch and learn. Other sectors in medicine are not always that easy to launch and learn, but we launch and learn. And we've done that with a minimal viable product, like, the lean startup, like in the software application textbook, we just packed our product in a minimal viable product, which was a manual, laborious, 3 hours work of technician type of product outside of the workflow. I mean, you name it. But we want to make sure that at least we can put a big check mark on this part called clinical utility. We want to put it in the hands of physicians in real clinical practice and show that it's actually working.
And get their feedbacks.
Yeah, and guess what? First of all, it's a hard process for a company. It matured the company. It was a classical 0 to 1 process from, doing experiments in the lab to putting something in the hands of physicians and labs. You need to establish, the regulatory framework, manufacturing, QA, training, support, you name it, everything for just treating patient number one. So from 0 to 1 is enormously hard. And this was the first part. Now, once you put it with the hands of physicians, you can validate the clinical utility, but hey, you can also try to ask, some really interesting questions about the health economics. Because once you introduce your product, you can start quantify how much antibiotics was prescribed, how many chest x-rays were given, how many other tests were, sent to the lab in the treated or diagnosed group compared to a control group. And how does that impact hospitalization? How does that impact decision-making? And overall, I can say that we could achieve both in doing this launch and learn. We're very focused on the clinical utility, but side by side, we understood that there's, real meat on the bone when it comes to the health economics. And, this is an ongoing process still these days to create the data for insurers all the time, to make sure that they understand that we didn't come here to spend their money. We actually came either to make them break even with a better medicine or actually save money to the system, which is a very strong argument if you can, solidify with data.
How long did it take you, the part of creating the technology, before you went into creating the product, the MVP?
So it was a very, very long and painful product, or I would say discovery process. We started with an hypothesis that we can basically utilize computational tools to identify those molecules that we would like to measure. And that actually didn't really work. Again, I said before, whether biology is dancing with you. So biology is not always that trivial to crack. And we took it in a two-way approach. So the first one was a more computational data-driven, and second one was a more rational design type of approach. And I can say that the more rational design type of approach eventually brought better solutions or better outcomes. We took 3 years with like 2.5 people.
Wait. 3 years.
3 years.
How do you manage 3 years of working on technology? Did you got a seed investment before? Did you have, some funds to do that? Did the family support you over there? That's 3 years of working, trying to crack a technology.
The first year, no money. No money for you, like in Seinfeld.
No money for you.
No money for you.
No money for you.
You actually take me back to Inception, so we didn't mention that, but this year of Eureka which was not really a Eureka, it was a long process of Eureka, not a moment, but actually many moments. But it was 2009, and for those young entrepreneurs that don't remember 2009 or they were youngsters, 2009 was a miserable financial year. It was immediately after the subprime crisis. The entire banking system, the entire financial system was completely...
Ouch times.
It's ouch times. It's ouch times. I keep on saying that even if you had a perpetuum mobile, right, you wouldn't get an investment in 2009. It doesn't really matter. All VCs were in the bunker. Many of them were not even, direct and honest enough to say that it doesn't really matter what you're going to say. They're not going to invest. They were just interested in hearing the story, keeping themselves up to date, So, in retrospect, I feel a little bit like a clown that moved from one VC to the other with Iran, presenting our idea and our hypothesis, trying to fund this venture. And, after... I cannot say that we're critical enough to understand that in real time. We were just, we just failed, right? We just failed to raise money. And then we decided that after failing to raise money, there was this very fundamental question. Do we really believe it's going to work? And if we really believe it's going to work, we should put our money where our mouth is. And even though we were just 2 PhD students, and we don't have tons of resources, we should take these, limited resources and try to show the world that there is some evidence behind what we're saying here. And that's exactly what we've done. So I came back to my professor in infectious disease in med school, said, hey, listen, Professor Potesman, we're interested in running this study in your hospital. We will buy some reagents. My PhD mentor gave us a bench in his, spin-off startup in the Technion, and we just started working on our own dime. There was this amazing guy I knew from my PhD that sold reagents for research to the labs. I told him about the idea. His name is Ariel Todar, and he just said, okay, Kfir, so you have a $20,000 check. Once you raise the money, give it back to me. Till then, you have an open check. Order whatever you need. I'm covering you until you have money.
So we backed you up with 20K? That's what you're saying?
Not real money. I mean, just products. So I ordered reagents, and he was basically waiting with the bills until we'll have money. And he said, and if you won't have, never mind. So
great story.
So amazing individuals, that, I mean, these stories tends to be forgotten later on, that, people have, right now, MeMed is a 9-digit, I won't say the exact number, but it's a high 9-digit valued, company and like over 70 employees, almost, I think, approaching 100 very soon, raised over $100 million. And in a mega round right now, and got over $50 million from the US Department of Defense and the European Union. And it's really easy to forget that this entire goddamn machine is built on, on the good spirit and hard work and innovation and blood, sweat, and tears of a handful of people. And yes, you cannot scale anything with a handful of people. You need to scale. You need to build a team. You need to build operation. You need to build further infrastructure. And U.S. commercial entity, et cetera, et cetera. And maybe we can talk about the second part of the journey. How do you make a 9-digit valued company into a 10-digit valued company? What is the next inflection for companies like ours? But it's really easy to forget these early days, which are just, full with amazing individuals, smart, generous, supportive, that are actually making this entire journey possible. So this is how we started. We created the initial data. At night, I finished my my med school shift, went to the hospital, recruited patients, drew blood, signed them on informed consent, took the blood to the lab, spent the entire night creating the data. The morning, went to sleep for a couple of hours before med school again, and sent the data to Iran for analysis. So this is how it worked when we just started. It was as lean as you can probably imagine, and it is possible to make a lean, I think, operation in medical.
Gotcha. So we have this early stage journey where you say you had a vivid vision and you went on with a run and you did everything. You created the technology and then you created an hardware as well, which is even tougher, right? And then scaling, creating a real company, engaging with clientele. Let's go into that part of the story.
Let's say a couple of words about the machine.
Go ahead.
And I think it's a really important thing. We discussed before the strategy, right? Whether your strategy is dependent on a third party or not. So in diagnostics, there are two parts for a diagnostic test. The first one is what you measure, and the second thing is how you measure it. Let me give an example. You have a strep test. What do you measure? You measure streptococci in your throat. How do you measure it? You can culture it. You can have a rapid strep test. You have all sorts of methods, okay? When you're creating a diagnostics like ours, the first question was, what do you measure? How do you actually provide an accurate result? And these were proteins of the immune system integrated with the software, providing a very accurate, over 90% sensitive and specific result. The how was still open, because if you want this diagnostics to actually make an impact in the real world, it needs to be provided very quickly, within minutes, in a cost-effective manner, in an easy-to-use format, okay, that can not only serve hospitals, but actually the outpatient setting. So after this exercise of minimal viable product in 2015, we understood that in order to take this product independently to the market, it's not only enough for us to have the what, we need also the how. Or in other words, we need to build our own machine. And we're not an engineering company. We're a biotech company. What do we know about hardware and software and product and UX and UI, right? and ergonomics? Nothing. So that's part of reinventing yourself as a founder, as a CTO for me, And eventually it was down to the question, can we buy off the shelf a platform? And there are many point-of-care platforms out there. Can we just license one and utilize it? And that was our preferred route. And I spent 2015. I don't want to tell you how much money I burned. By
the way, by that time, you already had some funds in capital?
Yes, of course. So we were funded at the end of 2010 after working in the lab on our own about 6 to 8 months, and after trying to raise money for another year. So it was roughly 2 years until we were funded. Okay. In 2015, as I told you, we put this product in the hands of physicians, and it was a wow. So they were really excited about the results because the results were very different than what they were used to. It's an immune response saying it's a bacterial virus. It's completely different than anything they saw so far. And not in a way that it's completely different and makes everything else, irrelevant, but it's a completely orthogonal type of information, could really help them to make their decisions and make better decisions. But again, the next step was how can we make it, like a 15 minutes type of test? Because as I told you, it was a 3.5 hours, 3 hours in the lab, once a day, outside of the workflow. And it was obvious that this product is not going to scale. So in order that to scale, it needs to be a plug and play, 15 minutes, super accurate at the physician's office. Go. And you're a biotech company. So what do you know about devices? Literally zero, nothing.
So how do you learn?
So first of all, you go to what other people have done and you learn from that. And I was trying to approach practically, so 2015 was the year of scouting. And I made this list with a friend from the Silicon Valley of all the point of care platforms out there in the world, including Elizabeth Holmes Edison's device, which was part of my Excel spreadsheet. And I said, okay, we're just going to approach one by one until we find a platform that can work for us. It needs to be accurate. It needs to be clearly regulated by the FDA. We need to have a clear route on how to regulate that through the FDA. And it needs to be manufacturable. I'm not manufacturing here anything that has 100,000 tests a year. This is 100 million tests a year type of technology. So it needs to be a scalable, manufacturable, a operationally realistic type of approach. Mm-hmm. And guess what happened at the end of 2015?
I'm waiting.
So even though I really hoped and I was really trying, I really did my best, really. I had to come back to my partner and back to the board and say, hey guys, I'm really sorry, but there is no such device. Except for senator status in Lufthansa, I gained basically nothing in this year. So I was literally traveling the globe in trying to find a platform everywhere you can possibly imagine. Australia, in the East, in Asia, the UK, Germany, United States, of course. I mean, you name it. And I even had a few pilots, but they all just failed. And except for my senator status, there was nothing left from 2015 and just a little less money in the bank account of the company. And the statement was, listen, I think that there is no other chance. We're going to build our own platform. And hey, you know what? We're going to build a platform that is going to be so amazing that this is going to be the infrastructure, not only the language. This is going to be the infrastructure that will allow MeMed not to be a one-trick pony. It's actually going to allow MeMed to be, a product pipeline, platform play type of company. And that's exactly what happened. So this was a very long process. We can also talk about how do you develop a device in a non-engineering company. By the way, we outsourced almost everything. And I managed this process with a tiny team of individuals among five different companies, one in Melbourne, Australia, one in Boston, one in Munich, one in Milano, and one in Switzerland. So 5 companies, each one of them contributed a completely different thing. The guys from Milano, as you can probably imagine, were responsible for the design.
Some fashion.
It was an amazing journey because we actually picked companies. Each one of them is tier 1 company in what we needed. Actually, we were willing to pay a bit more for that, but we knew that we'll have very strong partners. And the challenge was how to manage it all. And the only way to manage it all was just to live on planes. So for the last 4 years, with the generous support of the US Department of Defense, which actually supported and financed some of these activities, we developed this product, this analyzer called the MeMed Key, which is a tiny machine that does exactly what a central lab instrumentation is doing. It just does that in a 25 centimeters, square centimeters footprint that can be put here on the desk, very easily. Doesn't require water or waste or anything. It's all inclusive. So that was the machine part. And the reason I'm mentioning that is because that's exactly what turned MeMed from an asset-centric company into a platform play. Gave the company enormous amount of value. Because now, all of a sudden, when you have this device and it's placed in the physician's office, you can be the route of other companies like yourself 5 years ago to get into the market. And B, it can allow you to create tons of new content, and you do not rely on anybody else to make the measurement. The giants of the world that have these large machines in the lab that you need to beg to actually, put your test on their machines. So you're completely independent. You have a complete independent route to the market.
I want to focus on that. It sounds, you say 4 years, 5 companies, living on the airplane. Some of our audience might sound fun. I wanna go into the details and get some high resolution information on that. Orchestrating this 5 companies, creating an integration between them, syncing everything together to create this beautiful platform you're talking about. That's great work, but hard work, and I'm sure there's hustles and many challenges on the way.
There is. So I don't know where to start. Maybe you should guide me, but I think it all starts with with a product requirement document. So eventually, it's not the document itself. It's actually the decision, first of all, internally as a company, and after validating with the market, what needs to be done. What needs to be built? In medical devices, there is a very high cost for overbuilding and underbuilding because unlike software, which is very fragmented and very flexible, when it comes to screws and metals, if you're doing a mistake,
it's a big mistake.
You're going back, quite a few steps. So I think the most important decision when you're trying to do that is to approach it from 2 completely contradictory perspectives. The first one is what is absolutely necessary, and what do you decide that you're not going to build, or what is not going to be included in the product.
This is 2 important points you're suggesting now. So what not and what must be there.
Indeed. And you focus on the must, and despite everybody's pressure from around, you say, hey guys, no, we're not building that. Sorry, it's just not gonna end. It's hard enough. The probability of success of building a product like ours is about 5 to 10%. I didn't know that when I started the project. It's good so, right? But I didn't know that. And the reason why people fail is for 2 main reasons. One is that they just didn't have the technology in place. This was not our case. I was trying to make every possible effort to base our device on available technologies, not to reinvent the wheel. So it's just a new puzzle. But the pieces, the material for creating the pieces is there. It's just a new puzzle. And the second thing is that people tend within the development process to get into these rabbit holes of, we're already here. Let's also do this, and that. And hey, guys, this is not disciplined, and this is probably going to kill the product. If you do not know how to be focused, how to be disciplined, not only towards yourself and your partners, but also other stakeholders. So people around will always tell you, but hey, we're already here, and it's going to be a big toll to, redo that in the future, et cetera, et cetera. You need to be very, very focused on what must be done and what will not be part of the project.
That's a great tip, Oved. That's a really great tip. What you said, I'm sure that entrepreneurs are just all the time having this issue coming up and say, we're already here. Let's do that. This will be the greater solution of it. But your tip is just focus on what needs to be done.
Yes. And I had the privilege to be able to say what is a must. So if, for example, you're building an application and you're trying to learn, to launch and learn, that's a different exercise. I'd like to make that very, very clear because people don't always know what exactly needs to be built. Sometimes they're actually exploring. So during the exploration phase, do things like, do the Pareto, launch, try to get as much feedback as you can until you focus on what needs to be done. Everything I'm saying here is common knowledge. That's the ABC of entrepreneurship, right? Of technological entrepreneurship. When it comes to medical devices, again, when it comes to hardware, you need to be a bit more, or let's say much more focused on what needs to be done, what needs to be built. And maybe another angle that is worth mentioning is a medical product of the 21st century. So if you would get into a lab today or physician's office and you'll look at the equipment, it sucks. It's just not reliable. It's hard to operate. It's hard to troubleshoot. It has a terrible UI and UX and experience and what have you. And the vision behind this product was actually to find something that, a product that is going to be, a consumer product in
inside
its character with a lab inside. Exactly. So let's hide all the complexity. Let's make it simple, beautiful, easy to operate, approachable, easy to troubleshoot, clear messages, clear answers, Let's invest a lot on the physical design and the digital design to make this product the 21st century medical equipment. And that is something that I highly recommend. I know today is more and more common, but when it comes to medical companies, many times people say, yeah, but it's functional.
Yeah, it's for medical.
It's for medical, but you know what? It's for people. And those people have an iPhone in their pocket and they got used to this standard. And if you're going to be significantly worse, you're not going to create, I would say, a great experience, and therefore the willingness and the interest to continue and use your device, but actually to try to use it as little as possible because it's not fun. And gamification is not a bad thing, and amazing user experience is not, a bad word or curse in medical.
It's always greater value. Yeah,
Indeed.
It's always a greater value, and it connects with your approach or angle or vision to push that innovation forward. I think it syncs with that, right?
Yeah. And the entire, I was trying to focus on the device because I think the device is the terrible, most beautiful thing that happened to MeMed. And again, in real time, you can never say that. When I ended up 2015, I was terrified because as a CTO, as a co-founder, I understood that no chance our company can succeed and can extract the value from what we've built without actually building the device to do the measurements. On the other hand, I had zero knowledge about how to build an instrument. And from a third perspective, I said, there are so many products out there. How come none of them is suitable for our needs? I mean, am I missing here something? And this decision to actually build our own device was composed of two elements. It was a necessity, but in many cases, this necessity is actually means that you as an entrepreneur, you've identified a need that is unmet out there. Because you can be sure that there are other companies like MeMed today that look at the MeMed key and approach MeMed and say, hey, MeMed, maybe we can put our tests on your device, or maybe you can out-license your device because we built something that was actually targeting a need which was unmet. And therefore, even though this was a necessary evil for us as a company, it was not in our original plan. It would be a lie to say that we planned to build a device. It would be an absolute lie, okay? We went out, built this product, and on the way, as part of that, created amazing amount of value to the company, our shareholders, and hopefully the world with our ability to make those tests and other tests more accessible.
So from defining a pain, going into your idea, creating the technology, you then actually addressed it in a different approach and you exposured more things in the journey, and then it clicked.
Exactly.
All right, let's go forward. You're a company. You need to scale up. You need to market. You need to go into the market. So tell us a bit about that. Sales, marketing, creating the company.
First of all, this is absolutely Eran's role. So for me to talk about sales and marketing, I can talk about R&D, essay development, engineering, product, operations, regulation, clinical, medical, everything.
Part of marketing and sales.
But no, on a more serious note.
Yeah.
Just because, again, I'm also the chairman of the board and also a board member. So strategy, and I'll try to talk about it from a strategic perspective, less from a practical perspective, because, again, that's not my day-to-day. But I think one of the biggest challenges for a company like MeMed is actually after you cross this valley of death, okay, if I may call it this way, you're well-financed. You have a product, it's working, it's targeting a real problem in the world, it's bringing real value, is how do you build the next chunk of value? I mean, again, as I said, we're a high nine-digit valued company. How do you go to the 10th digit? And not just by pushing valuation, okay, just by creating real content, creating real value. So I think marketing and sales and commercialization as a code, okay, as a code word, is one way to create value. But for technology companies, commercialization alone is not enough. So on one hand, MeMed is very focused today on building commercial entity in the United States, actually brought up, top tier executive to run that, not be run here from Israel by an Israeli executive, but actually be run by a professional, marketing and sales, commercial guy in the United States, foot in the ground, building his, organization to do that, because they do it like 100 times better than we do.
That's true.
And modesty is really important. You need to know what you do best and what you do less good, okay? You need to be very honest about it with yourself. But I would say that if MeMed from here on would be a company that is only focused on organic growth and revenues, then we will not, I think, we will not extract the value that we were built to create. And what I mean by that is that side by side with commercialization, which is extremely important, manufacturing, service, marketing, sales, pricing, reimbursement, there are a lot of curses there that needs to be, again, done by a professional sales and commercial organization. There needs to be a second arm of innovation. And when I say innovation, I mean like bacterial versus viral. So we're basically the host response company. The host response means that we're actually asking the body, hey, how is this tissue? Or what's going on with this inflammation? Or how is this interaction happening right now? And by asking these questions, okay, you can provide answers not only in infectious disease, but also in a traumatic brain injury, in acute coronary syndrome, in stroke, in kidney failure, in liver failure, in anemia, you name it. Eventually, that's the language. We have the infrastructure, we have the language. And if we focus only on commercialization, this is not going to be a unicorn. It needs to be a commercial, an excellent commercial entity, side by side with tons of innovation. Scaling the innovation, yeah. Exactly. And the framework is there because the device is there. It allows you to measure effectively. The ability to perform clinical studies, to do biomarker discovery, to develop assays is there because we've done that over and over again, okay? So the team knows how to do that. Now, guys, go and replicate this concept or these concepts and create new content, create new medical value. And these two can allow a company to grow from, where I say that we are right now to the place that I think we can be and should be. And by the way, this content can also be acquired, so it doesn't have to be invented in-house only.
Gotcha. As a designer, I just listened to you and I think you say, we created a language, so now you're expanding that vocabulary. So before we actually end this episode, we have the entire audience globally listening to this episode. Try to crystallize and bring us your greatest tip ever for entrepreneur. It could be one, it could be two, up to three. Up to three. We don't have enough space, but up to 3 great tips that any entrepreneur, not only in the medical environment
It's
and
easy.
industry. Go ahead.
But it's so unoriginal.
All
It's so easy.
We're sometimes cheesy, but if it works, it works,
So
you know?
it's cheesy. I believe it, wholeheartedly. So wake up in the morning, do only things you're super passionate around, and do it with people you love. You really love them. You love working with them. And if you do these two things, 85% of your happiness is there, and 85% of your success is there. The rest, the last 15% is just luck.
All right. We get it a lot, but I understand it might be true. All right. If a lot of people, entrepreneurs, successful entrepreneurs are saying it. So again, thank you very much.
Thank you.
This was another episode of our TLV DNA. Thank you very much to all the audience around the world to listening to us. You can listen to us on all major platforms from Spotify, Apple, Google, and watch this episode on YouTube. Thank you very much.
Thank you. It was a pleasure.
Mine as well.